episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor. Welcome, everybody, once again to another episode of our show, bringing you not one, but two fascinating guests today, helping to create a better tomorrow on many different fronts. Today, we're back with our friends at NTT, or the Nippon Telegraph and Telephone Corporation, specifically the NTT Data Services division, which is a global digital business and IT services leader focused on a range of business services, including cloud, data applications, and which was recently embarked upon this ambitious new initiative as part of their goal to change the future for good, ultimately reimagining health and well-being towards what NTT defines as a more human-empowered, knowledge-driven, and tech-enabled approach. And as is mentioned, we have not one, but two wonderful guests joining us today. First, we are joined by Lisa Esch, Senior Vice President, Healthcare Provider, Digital Health, Innovation, and Industry Offerings. She oversees NTT Data Solutions and Offering Development, as well as their go-to-market strategy within these verticals, and serves as a subject matter expert in their client engagements. Lisa has extensive background in disruptive tech, healthcare innovation, strategic planning, and business process improvement. Before joining NTT, she was senior healthcare executive with DXC Technology and Computer Science Corporation, where she served as chief innovation officer at Providr Healthcare. Along with her executive career, Lisa has served on the boards for Empower Education International, Children's Heart Alliance, Head Start Health, and Student for Student. She began her healthcare career as a registered dietitian. She's a bachelor's of science in nutrition, University of Nebraska, completed her graduate studies in public administration, University of Colorado, and is a Yellow Belt certified in Spartan sales training, and holds a certificate in medical nutrition and dietetic internship from University of Nebraska Medical Center. We are also joined today by Dr. Michael Petersen, who is Chief Clinical Innovation Officer at NTT DATA Services. Michael joins NTT Data from Accenture, where he helped shape that firm's health equity point of view, capabilities, and ecosystem. Before working in healthcare IT, he was an emergency medicine pediatrician at several large health systems, including 5 years as chief of pediatrics at Barnes-Jewish St. Peter's Hospital. And prior to that, served several years in the United States Army, developing his leadership skills there as well. Michael has his medical degree from University of Texas Health Science Center in Houston. He did pediatric and emergency pediatric residency and fellowship at Washington University in St. Louis. Lisa Esch, Dr. Michael Petersen, welcome to our show today.
Well, thank you, Ira. It's great to be here.
Good morning, Ira. Thank you.
It's really great having both of you here today. This is a really exciting set of topics we're going to be getting into. What I'd like to do, though, before we sort of get into the whole NTT story, I'd like to hand the floor to both of you for a couple minutes each, just to talk about your personal interests and journey in health and wellness. Now, Michael, you come into it from medicine, Lisa from the health and nutrition side. Talk a little bit for a couple minutes about your own personal interest in this very important space.
Yeah, thank you, Ira. This has been, my career has been in healthcare, my whole career. And, both Dr. Petersen and I started in clinical roles, and now we're working with this amazing technology company. And health and well-being is really at the core of why people typically choose healthcare careers as well. And so for me, it was, the transition along my career from being a clinician to helping and working in organizations that can really influence outcomes, can really influence health in the community, healthcare is local, and what well-being looks like. It's an exciting place to be in this part of my career. And as we've seen with the pandemic, and when you think about health and well-being, that healthcare is no longer just limited to provider organizations, healthcare like we typically think of it. It's really crossed the line where employers are now responsible for health and well-being, communities are responsible for health and well-being. So those boundaries of how we've typically thought about health and well-being have been blurred. And it's a really exciting time to be in this space to really help with the transition that we're seeing.
Yeah, I think for me, it's personal. I was adopted when I was 2 from Vietnam, and I had always felt this sense of what can I do in my life to pay it forward. academically in school, almost failed out of 8th grade. And my parents were just very happy to see me graduate high school. So I grew up in the Army and was in the Army where I reflected on how, what my career journey might be. And so I got into undergrad and just started this pre-med program, and was really informed by experiences in volunteering at the hospital as a pre-med student. Fast forward, getting into medical school, and I ran a free clinic, basically called the Good Neighbor Clinic in Houston. Mm-hmm. And it was those experiences that really solidified my aspirations to really help in underserved communities. And then obviously in my residency training, a lot of the patients that we saw at St. Louis Children's Hospital were from underserved communities. And I really got a sense of the need that healthcare isn't just this episodic experience, and that it's really about a personal, as Lisa alluded to, health is incredibly personal. Mm-hmm. And how people consume it or get involved or engaged are different for what's important to them. And so I think that's why our health and well-being white paper is really important, because it really gives a sense of why we need to be more personal. So getting into becoming a pediatrician was my dream, and I got to do that for 12 years on the front lines, and realizing that I was really having these transactional positive experiences, but I kind of wanted to do more. So I widened the aperture of my focus and got into consulting. And really that's when I've got incredibly passionate about trying to solve health equity, social determinants of health. And when you work for a company like NTT DATA Services, with parent company at NTT, we have at our fingertips the opportunity to really build incredible experiences and journeys for patients, but also using data and analytics to really help drive the right experience for the right patients. So it's really just been an amazing roller coaster ride. So I'm absolutely glad to be here and share our story.
Outstanding. And as I mentioned in the intro, August 4th, 2021, NTT unveils this ambitious new program focusing on basically ways for organizations of all types to rethink their health and well-being initiatives. Just to read a little bit from the PR, NTT today unveiled a global initiative calling for multiple stakeholders to rethink the importance of health and well-being at every level. Initiative will offer ideas and set of resources designed to help governments, communities, and organizations re-examine their approach to personal health, mental health, social health, workers' wellness, and equitable access to support a more sustainable future. And, Lisa, you were mentioning at the beginning sort of the unique time that it is. There's a blurring of the lines going on. I grew up with the thinking of healthcare as names like Pfizer and J&J and United Healthcare, but now we read about Apple and Google and Facebook and Uber and everybody getting involved in health in some level. Talk about NTT. Why health and wellness, and why now? And talk about sort of the general goals of NTT Health and Wellbeing Initiative.
Yeah, so, we're really excited to be leading this initiative. And it starts with, we've got 4 key pillars that are the foundation of this: human by design, trust and trustworthiness, the health of me, and the digital ecosystem. And these 4 pillars really drive what we believe health and well-being across all of those places where human beings engage, and how we can really affect that. And NTT is uniquely positioned to support this because of we're a global company. We have many companies that touch technology, that touch healthcare, delivery of healthcare, the support systems in that. So in many of these places, we're engaged with that. And, it's exciting to really take that to the next level and help organizations that haven't maybe traditionally thought about health and well-being and the importance and the impact they can have on their employees, on their communities, and, with their neighbors and all of that, and how we move forward with that. So we really do have a unique role in having this impact globally, not just in our country, and leading with these initiatives, these ideas, and helping organizations with this transition.
And Go ahead, sure, Mike.
And Mike also has some, some thoughts on that, just from his experience as the clinician and with that transition that we're seeing in the communities.
Oh, thanks, Lisa. And Ira, we all know this, right? So we're not singing to the choir. We're singing to the choir here. Basically, health is incredibly complex. Sure. And in this complexity, it's not that it's broken, right? Our system has the ability to treat people and get help when they need it. The challenge is that it's fragmented, and how people experience it is uniquely different based on their socioeconomic background, if they're in an underserved community or a rural community, and or their education from a health literacy or a digital literacy. So think about digital front doors, and how many clicks does it take to find a gastroenterologist if you know what that's the word you should be looking for. So having been on the front lines and it's seeing the impact of how episodic care is just not the way to do this in the future, it was really challenging the patients, right? How do they even find the emergency room? You walk into any hospital today, you have to really kind of figure out where the signage is, and they've done a better job than when I was a med student trying to take actual labs to the lab. They used to paint the hallways with specific colors so you wouldn't get lost. The point that we really want to focus on is that people, again, as I said earlier and Lisa alluded to, is that health is personal. Mm-hmm. And we have to make it easier. We have to make it easier for people to understand, to access, and to engage, and to be proactive. And we've always talked about preventative care. I was taught about that in medical school. But at the end of the day, preventative care is challenging if we don't provide people the systems and support and understanding of what it means. And also, from a practice perspective, we have to change this reactive care this episodic care model, and move towards a longitudinal proactive care model. And I think that what you alluded to earlier around all these new players, this convergence of Best Buy Health, the retail aspect of health, all the way to the traditional brick and mortar health entities, it's getting more complicated. And for patients, they're going to engage it in different pieces. And the health system at the end of the day is still going to be the person or the entity that people are going to consume this health from. And they need to really understand all these ecosystem partners and all these different players, and how are they going to stitch together a journey for a patient where a patient brings them petabytes of data now, and how do they consume it, how do they understand it, and how do they really deliver high quality care that's cost effective.
And it's human by design, and sometimes technology can make things impersonal. Yep. and can create these barriers. And we saw that in the pandemic. There were communities that didn't have the infrastructure and the technology and the access. It went away when they were forced to use technology to engage in healthcare. Mm-hmm. So healthcare can create more of a divide, but it also can help solve some of those challenges. And now we saw those really bubble up in the last 18 months. But the human by design is really, really key, because technology can be impersonal, and it also can be a little creepy. If you think about the AI and some of the things that are, happening behind the scenes and some of that. So there's this balance with healthcare that you have to have this foundation of trust and an element of personal that makes it human by design. And so it can't just be an application, a piece of technology that we think solves a problem. It's all connected. It's very connected. And we're also seeing, organizations that are looking at how broken healthcare is, like the Amazons, like some of those large non-traditional healthcare companies. They think, well, we can go in and solve that. And there's been some hiccups. You've seen something, big ideas show up, and then big ideas go away. It's not as easy as it looks. And anybody who's worked in healthcare for the decades that Dr. Petersen and I have, and many, many others, know it is not as simple as everyone thinks it is. And when you're looking from the outside in, it is very challenging once you get into the challenges of healthcare. And so I do think, as Dr. Petersen alluded to as well, and spoke to, is that we've got to come together, organizations that are not traditionally healthcare, coming together with healthcare, and to break down some of those barriers, and technology can help support that. And move together to really solve those problems. And people will begin more and more each day to access healthcare outside the traditional four walls of a hospital. And we're seeing that every day. Every day there's more and more happening outside than inside. And how do we stay connected? How do we keep it personal? How do we keep it specific? How do we take the waste out of duplication and just the lack of communication that happens as well? So there's some big challenges there, but we're really excited about the opportunities that those challenges bring.
You know, it's interesting listening to some of these points, and you know, the along with unveiling of the NTT initiative, you launched this white paper entitled "Improving the Health of Me." And once again, I could just read a couple sentences. It sort of goes along with what you were just talking about. The individual is at the heart of a health and well-being model that is human by design, trustworthy, and knowledge-driven. In this paradigm, which focuses on the particular needs and goals of the individual, me. Improvements require a new way of thinking about all the elements to define health and well-being. And then you go into how this is all about enabling the right technology, powered by trust, data, personalization, and precise care. And you know, we're coming about this theme about, you know, healthcare, the traditional healthcare model isn't what it's not here anymore. And you know, in this report, you talk about you know, faith-based organizations playing a role. I was just actually listening a couple of days ago to the Clinton Foundation's you know, initiative to bring together faith-based organizations to deal with the opioid crisis. Retail, as you were just mentioning, I have wonderful experiences at the pharmacy down the street now, treating and prescribing for my daughter's strep throat, which would normally take a couple of days to organize, but it's over in 15 minutes now. Talk a little bit more, Lisa, Michael, however you want to take this, in sort of some of the top line learnings, findings from the Improving the Health of Me report that were eye-opening to you as you synthesized all of this data.
Yeah, you know, I think what we started out describing is that healthcare is fragmented and the journeys are siloed. And as you described, this consumption of how health is going to be, how people are going to engage with health is going to be likely, 50% of it will be consumed at home in the future. You know, what we've learned is that the health of me is also the health of my family and what's important to me. And when we say human by design, we're talking about an empathetic design thinking model, which is we don't just go with white lab coats, go in a corner and tell a health system, here's how you build it. We actually get the voice of the clinician and the voice of the patient engaged in that design thinking. What we've learned is that patients don't just episodically go to the hospital and that's the cut and paste, that's the movie. It's really wrapped around where do they go to? They go to their community. And when we think of social determinants of health and when we think of how people interact, the convenience of having to go to the pharmacy or the inconvenience of having to go to the pharmacy, all of these things. And what we also learned is that a lot of the philanthropic and foundations by necessity have been part of our ecosystem of health, but they've never communicated. So you've required new entities like Unite Us or NowPow, Signify Health to become social health platforms to help clinicians at the point of care get people the help they need. So when you think about those experiences and trying to help not just the healthcare, but the social care aspects, and then you add in and layer in the mental health, the wellness of someone, of how they live, you really have to make that moment that matters at the point of care, because you're not going to get another chance once they leave those four walls. So if we empower the patient, empower the person, empower their family, it's incredibly powerful. When I practice, I would always see a lot of the patients in underserved communities. The mom rarely came by herself. She either came with an aunt, her mother, or her sister, or another family member that she trusted. And if you think about who we put on our emergency contact, we need to think about how health is delivered because we trust that person. So it's not when we give information in these very critical moments, whether she just delivered the baby and you want to help her give anticipatory guidance or education, you give it to both the person, the me, and their loved ones. And then they take that information and they take it back to their community. So that's one concept where I think what we've learned and why we've seen all these, just, I would say, a lot of noise in the technologies, right? It's hard for a CIO, it's hard for a chief data officer, or hard for a chief technology officer to understand which tools are the right ones for the right journey for their patients.
Yeah,
Please.
and yeah, Mike, you're spot on with all of the possibilities out there, but there's a lot of noise as well. And there's noise with providers, there's noise with physicians and clinicians taking all this information in. Even the patients, the consumer can be overwhelmed with all of the possibilities and all of the information. And we're challenged with how it all connects and how it all comes together to make sense, to point somebody in the right direction of where they need to be going. And so moving the patient, the consumer, to the center of this conversation is really key. And traditionally in healthcare, we sometimes solve problems in a bigger way that isn't so personal. And we're really moving to this more personal approach and engagement strategy with healthcare and delivering it.
Yeah, you know, I think there's an expectation from patients for a retail-like experience.
Mm-hmm.
They have this experience of being able to know their status from the airlines or their hotel status, and yet they're confused and don't understand their own deductible and how much money they have to pay left, and how they get billed by first the physician and then the insurance. So these experiences, and though fragmented and just not able to make it seamless, which is important, and they will migrate towards the most seamless experience, and that'll be the one that they choose. And when health systems are competing with one another for the delivery of care, it's going to be the one that can stitch these retail experiences, these other various players, and pull it into their ecosystem and make it work for the patient. Those are the ones that are going to be the real leaders in delivery of care in the future.
The innovation basket that NTT is focusing on here for this initiative is vast. There are, I think, 5 buckets in terms of innovations in personalized and precise healthcare, care delivery, healthcare system connection, intelligent automation, and digital engagement. And as we're joking before the show, we could spend hours going into all these. Some of these, like for instance, digital twin technology, we spent some time with your colleagues at NTT Research going into a few episodes ago. I'd like to do a little exercise here. Both of you, obviously, you wear your NTT hats. If you push those hats to the side for a moment, at least if you could put your medical nutrition hat on, Michael, your pediatric hat. Take us on, both of you individually, on a little walk through some of these future innovations that you're most excited about. I assume consumer-driven genomics, very interesting to you, Lisa. I'm sure the waiting room of the future, very important to you, Michael. But both of you, take some time to just go through this portfolio. What excites you the most? What are you looking forward to on the horizon in the coming years with these tools?
I'll start. The things that really drive the personalization of healthcare and just the specific things that someone needs that can have an impact on. So all the research around matching drugs with cancer treatments, that's exciting. The technology to be able to really personalize and engage and support people no matter where they're at in their journey. And there's wearables, there's sensors, there's all kinds of startups out there. I sit on a advisory board and review startups a lot, and we're trying to look at the ones what's interesting, what's not, how do we help them be successful, how do we help them plug into something. We're seeing so much innovation in this space right now, the little things, the problems, the places where there's a lot of tension in healthcare delivery that you can solve fairly easy and very quickly, but then it's solved, and how do you take that into this big clunky healthcare delivery system? Doesn't always work. So I think the things that really help personalize and go forward, we're seeing research on gut the gut bacteria and weight, gut bacteria and mental health, Like those things are so exciting as a dietitian. When you think about eating and healthy and wellness and those types of things, I love those types of things because people can just do that in their lifestyle. You can change things through education with lifestyle. It doesn't take sometimes a lot to do that. However, people are pretty stubborn with lifestyle, as we know. I always said I love working in pediatrics because parents will do for their children what they will not do for themselves. So, peds nutrition was always my favorite place to be. So there's just a lot that we're seeing, and it's so fast. There's just a lot to take in, and it can be overwhelming to healthcare organizations. It can be overwhelming to patients, to consumers, all across the ecosystem. So I think one of our jobs is to really help simplify that, help prioritize that, and take some of the noise even out of that space to really help look at what's going to have the biggest impact. How can this really plug into this disconnected ecosystem and support how we go further? So I didn't really talk about anything specifically, but those are the concepts that excite me really, a lot, the genomics and those types of things as well.
Excellent.
Yeah, I'm absolutely passionate about improving the experience of someone's journey. If we really think about, as an emergency room doctor, I remember people are coming to me on the day that they have the highest anxiety, they're scared, and I want to help. And I think what's exciting is that we'll be able to provide help seamlessly and get an understanding of who that patient is. So when I think of these journeys and this experiential effort, it's all driven by data and analytics. Those are the foundations for these digital experiences, and you got to get pretty smart about the right data. So when I think about the future, I'm thinking of how we change the model of care. It's going to be hybridized. This pandemic has taught us that we can lean on a lot more of the technological advances around telehealth, telemedicine, virtual care, all of those IoT devices that are going to be in the home. But what I really think about is making it more convenient for those in the underserved communities, but also just convenient for everyone. And when I think about the proactive analytics, meaning the predictive, is really around that when a future clinician sees a patient, they're going to get a longitudinal view of the patient from the data. They're going to get machine learning and artificial intelligence that helps them understand the top 3 things they can do to impact the best outcome for this patient and their family, based on pulling in social determinants of health data or social care data, and also their actual health data, and really bring in through technology, through digital referrals, giving them a complete, a much improved experience and a much bigger opportunity to help the patient along the journey once they leave the 4 walls of the hospital and know that they got the help. So I think when I look at the data, the digital tools that are going to be available, and the ability to consume this data rapidly, because it's only going to get more complex, it's only going to grow, but being able to harness that and manage it along that journey for the patient, and then give that patient this feeling of, when that they're getting the help they need and that they can live their lives. Because anytime just think about when you get sick and how inconvenient getting a fever is to us. Imagine having a long-term illness, as Lisa alluded to, cancer, or a long-term, something rheumatologic. As you start to think about those journeys, it's disruptive, and we want to help make health as least disruptive as possible. So that's why what's important to you and Lisa is going to be different than what's important to me and my family. And we have to build it so that that's what I'm excited about, that people will have an opportunity to personalize the way they want to engage. And that's important. That, like Lisa said, creepy. I think that's what everyone gets scared about health. I think that you can do it where it's, you're willing to, in the same way that we consume other retail experiences, and we willingly give that data. I think we're going to build health to a point where you get to put the protections you want and consume it the way you want and how you want.
And I know I use that word, and because that's the reaction when we talk about this, Ira. When we're talking about doing this type of analytics around, patients, people are like, no, they kind of take a step back. It makes them very uncomfortable. And so uncomfortable is probably a better word. However, there's a balance, and we can, there is a balance that can really help people be more prescriptive.
Yep.
And rather even beyond predictive. and have it be prescriptive and helpful and not intrusive and not creepy as well. So there's this balance, but there's so much behind the scenes that happens, and there's a lot of mistrust with data right now, and with healthcare data in particular. So we've got to establish that element of trust and trustworthiness. It's one of our pillars, and it's really key to the advancement of where we need to go for this humanized, personalized experience of healthcare.
And is one more part of that particular question, and Michael, you've been mentioning a couple of times, and I really want to emphasize it during the show, the social determinant side of health. And this is something, and once again, we have a broad spectrum of experience here on the call, everything from prenatal care and pediatrics, all the way through life to issues with ageism, aging in place, the smart home, and so forth in our later years. Michael and Lisa, please come in on this one if you want to. Just say a few more words about the health equity component of this and how technology really can be a balancing tool for this really crucial part of the healthcare puzzle.
Thanks, Ira. That's a great question. I think about it this way. Our philosophy is to inculcate and leverage health equity in everything we do, and in terms of the way we work with our clients. The way that it might help transcend and break some of the barriers, when we look at the pandemic and you look at the 50 to 60 years before the pandemic, these are not original stories in certain underserved populations, whether they're rural or urban. And what we find is that chronic disease is prevalent, the burden of disease is prevalent, the burden of mental health is prevalent, and they're all tied to access to care, transportation challenges, education challenges, socioeconomic challenges. And if you can't solve for those, people will stay in the same chronic diseases that they have and really suffer. And so what we think are opportunities, now you've got to solve for the digital divide, because if you lead with an app, or you lead with a digital tool, or you lead with something that requires Wi-Fi or broadband, right, you're gonna bias your effort. So what we believe is solving for that digital divide. But once you do that, so as an example, rural healthcare can help. What can be solved is through telehealth, telemedicine, and some virtual experiences. But even then, you're still, from if you have an oncology patient, you might be able to go to your local retail, get into a soundproof pod, and engage with your specialist without having to drive a 3 or 4 hour drive. I think these technologies and these tools are there to augment, right? At the end of the day, they're catalyzing an experience between two humans. And what we really have to do is make sure that it's equitable for all. And by doing so, like I said, you can solve the transportation barrier. You can also help solve for food insecurity. And I think that's for most of the health plans and most of the health systems, that's the number one focus on social determinants of health. And by doing that, they're looking at leveraging technologies that help refer patients, and then also track and ensure that they get the help they need, and then tie them back to outcomes. And at the end of the day, food is the one thing that helps add one of the biggest factors in our health outcomes. So by doing all of those things, transportation, solving for food insecurity, and then helping with digital literacy and health literacy, you make people more able and capable to consume health in a better way. It's just as simple as being able to ask and coach someone to ask your doctor a question. Think about how you feel like you're there and you're inconveniencing them. My wife doesn't care. She pulls out her iPhone and she's asking 1 million questions, and we have to give people that same empowerment to maximize that time. So I think that those are the trends that are happening around solving for the social terms of health and solving for health equity.
Outstanding. Lisa, coming back to NTT now, obviously NTT one of the largest telecommunication companies in the world, one of the largest companies in the world. This is more than just one, small initiative. You have to integrate your responsibility here: NTT Data Services, corporate, NTT Research, NTT Disruption. This is going to be one major part of the journey in integrating all of these components of this very fascinating company. But talk a little bit about what is responsible here in sort of leveraging and integrating all of these different sources at the organization.
Yeah, so each of our companies have strengths. And so what we're doing is really trying to understand the contribution of each team, of each business unit, of each company to come together, and how we work together to solve this. And different organizations within even our NTT umbrella have relationships with governments, whereas others have, with the commercial business. We have all of these places that we can touch organizations and people globally, and it is global. And I think that's what's so exciting about it. And our expertise is really specific to the business organization that we're in. But we all come together. We all agree that these are top priorities for us, and we're reaching into our communities, and we're taking this strategy, and we're incorporating into even how we're going to market with our customers. So we're bringing this conversation into all of our conversations that we're having with our customers. So it isn't just a corporate strategy. We're bringing it down into our business, and we're taking it to our customers as well. So they know when we're talking about health and well-being, and we're talking about these concepts, that we're serious about this. We're doing it ourselves as a company, and we want to show you how to do it as well.
Yeah, I think too, the pandemic taught us that it isn't isolated. It's a global phenomenon. And NTT being, we're thinking of it as a one NTT concept here. This health and wellness is a global concept too, right? The challenges of health, the challenges of mental health are absolutely global. And we bring the best of, especially given the investment in research, the investment in our VC group. Mm-hmm. And what we get to do, and Lisa and I get to pick the best of, or the things that are going to solve our clients' challenges. And I think that's the fallacy that occurs a lot in trying to solve for healthcare. They're like, I've got this cool shiny object of a technology. How can I fit it in? Whereas we think about it, what's the problem our clients are trying to solve, and then then kind of doing a scan of what could possibly help them achieve their goals in terms of patient outcomes, et cetera. So I do think that's the uniqueness that NTT is bringing to this mindset, is that health and wellness, as Lisa alluded to early in this discussion, which is everyone is engaged in taking care of health, whether it's your employees or your customers. In any industry, everyone is responsible for some level of health now in this new pandemic and post-pandemic world.
Mm-hmm.
What for the next generation that may be listening to the show now and coming out of college or trying to figure out what they're going to be doing, what is NTT looking for as you build up this very important part of the company? You're looking for clinicians, tech folks. Say a few words, both of you, if you would, for sort of the next generation that's listening and wants to get involved.
So we're hiring a lot of the next generation, new college grads, young adults who have 1, 2, 3 years of experience and want to move into this space. So what we're looking for, I would say, are problem solvers. So no matter what your background is, we're in the business of solving problems. And it could be, we solve problems with technology, we might solve problems with a new process, we might solve it with some people, but we're going to solve problems. Mm-hmm. And that's what we're looking for. And we're hiring very rapidly right now. And we're excited about training this new generation because they get to see the best of what's happened and where the future is going. And this is really an exciting time to be in this space.
Yeah, I think we expect our business to grow in the healthcare space. But I think from a ubiquitous perspective of the company, we're looking for diversity as well. It's one of our pillars, to be inclusive. And we're looking for people who are interested in really changing, it sounds cliche-ish, but really changing outcomes in people's lives. I often say that you might be working on, as Lisa said, like a workflow, But that workflow at the end of the day, again, catalyzes a moment between a clinician and a patient, or helping a client leverage a technology where a patient can get access to care, all of those things. So what we're seeing too in this new workforce is there's a social consciousness that they're looking for companies that have the same aligned views on helping. And I haven't met a single person who is interested in healthcare who's bored with their job.
Fascinating set of initiatives, and I really look forward to seeing how this all unfolds. And you know, as Lisa, you were saying at the beginning, you know, health isn't easy, and many have tried before. Some have succeeded, some have not. But it clearly seems that NTT has all the pieces and the right minds putting this together. Any final messages from either of you as we get ready to wrap up the show?
Well, I just thank you for the time today. This has been a great conversation, Ira, and we appreciate the opportunity to share our vision, what we're doing, and what we passionately believe is the right thing to be doing in our business.
Yeah, I just want to end by saying thank you as well, and giving us a chance to share what is important. And I think health and well-being is absolutely vital to the future of our world, especially as we endure these challenges with pandemic and other things that may come along. I do think too that we are focused on being at the table with our clients, and that, you know, health is hard and it's a heavy lift, but what we are here to do is to be this connective tissue to really help our clients bring in, it's not an N of one, it's an N of many. Mm-hmm. And we really believe in this ecosystem of partners to really solve this complicated challenges that exist in healthcare.
Great messages. For everybody that is going to be listening to this episode on our podcast networks or watching on the YouTube channel, you've been spending time with Lisa Esch, Senior Vice President, Healthcare Provider, Digital Health, Innovation and Industry Offerings, and Dr. Michael Petersen, Chief Clinical Innovation Officer, both at NTT Data Services, part of the Nippon Telegraph and Telephone Corporation. Michael, Lisa, I want to thank you both for taking the time out of your schedules to come talk to us today. Thanks for everything you're doing there. And as we like to say on our show, thank you for helping to create a better tomorrow for all of us. A very, very inspiring story.
Thank you, Ira. Appreciate it.
Thank you, Ira.